Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Are you recovered from COVID-19? Here are 10 things patients should do after being discharged from the hospital. The novel coronavirus is known to attack the endothelial cells that lines the blood vessels, resulting in excessive blood clotting. Research suggests that many patients who have recovered from COVID-19 reported that they have infection had to be rushed back with low oxygen saturation levels to the emergency department just a day after discharge. Today we are going to discuss about post-COVID syndrome and their management. This means after the acute phase of COVID-19 is over, the patients come back to the hospital with some symptoms. And the risk factors are the factors such as smoking history, advanced age and comorbid conditions like diabetes, hypertension, renal disorders, etc. Symptoms: the patient who have recovered from COVID-19 might experience abnormal heart rate, chronic fatigue, persistent diarrhea, rapid weight loss and digestive issues, mild to severe inflammation in the brain, nausea, loss of appetite, taste and smell, reduced exercise tolerance, disturbed sleep patterns, muscle weakness, neuropsychiatric implications like depression, insomnia, etc. How soon can a person start seeking post-COVID care? It is important to seek post-COVID-19 care right from the first follow-up post-discharge, or usually around 2 weeks post-discharge. Then, as per requirements, clinical support, physical rehabilitation and psychological support can be offered. What COVID-19 survivors need to assess? The doctor said there are some important things that COVID-19 survivors need to assess to ensure that everything is in the range. These include daily check of oxygen saturation. It should be maintained at greater than 94% on room air. Watch for the respiratory symptoms, that is persistence or worsening of the symptoms like cough and breathlessness, persistent rise of the body temperature above 100 degrees Fahrenheit, and also watch for the symptoms of lethargy, drowsiness and altered sensorium. Regular monitoring of blood sugar in non-diabetic patients is needed. You have to note that COVID-19 infection, as any other infection, alters blood sugar levels of the body. Strict monitoring once in 3 days and regular consultation with your doctor is required. Regular blood pressure monitoring in non-hypertensive patient is required to avoid accelerated hypertension related complications. Weekly, the blood pressure monitoring in case of controlled hypertension or more frequently in case of abnormal reading is required. What happens if a patient skips this assessment? The patients may go into cytokine storm, immune cells flood and attack the lungs they should actually be protecting. Blood vessel could leak or the blood starts clotting. Blood pressure could plummet and organs could start to fail. The secondary complications are highly common in post-COVID infections like pulmonary fibrosis, pulmonary embolism, renal failure, liver dysfunction, coagulopathy, that is excessive bleeding or clotting, acute stroke and myocardial infarction. A study conducted in Italy showed an overwhelming 87.4% of the patients who have recovered from COVID-19 reported persistence of at least one symptoms, particularly fatigue and dyspnea or labored breathing. This was reported even after 2 months of being discharged from the hospital. I hope you understood about this epidemic in day to day. We are not aware about COVID-19. We just see it's like a viral fever. The post-COVID now emerged in Kerala also, the state with low mortality rate. Our mission is to just aware you, and your mission is stay away from this pandemic by taking it as a serious matter. Stay home, stay safe. Thank you. Have a nice day.